Have you ever wondered why Medicare Advantage plans are pushed so hard? You see a lot of heavy advertisement, especially as you turn 65 or maybe in the fall during the open enrollment period. I want to talk about that in today's video, so I hope that you stay tuned to the end. My name is Jamie. I am an independent licensed insurance agent. I help people all over the country understand the Medicare program and get the coverage that fits their needs. If you have any questions for me, I'd love to do a free no obligation chat with you. My phone number and website is in the description of this video. So I was online actually today and I was looking at just some information about Medicare. I do that all the time because I am an agent working exclusively with Medicare beneficiaries, and sometimes I go down to this rabbit hole, so to speak, of information about Medicare, Medicare supplements, Medicare Advantage plans, what's happening in the market. And today I noticed that there are quite a few people who are using the internet to research why Medicare Advantage plans are so heavily marketed. And I know this from firsthand experience because I talk to people almost every single day about Medicare, and many of them ask me this question: why do I see this advertisement everywhere around me for these Medicare Advantage plans? So it's important to know the history of Medicare Advantage plans. Medicare Advantage plans came about through Congress about 20 years ago with the desire to help manage people who are on Medicare. They invited the health insurance companies into the process of taking care of Medicare beneficiaries. And so a Medicare Advantage plan is actually sold by a private health insurance company. It's known as Medicare Part C. So a lot of people hear about all these different parts of Medicare, and Medicare Part C is known as Medicare Advantage. And Medicare Advantage is basically an alternative way to receive your Medicare benefits. Basically what happens is when you choose a Medicare Advantage plan, you choose to receive your health coverage care through that private health insurance company. And so many times if you're researching Medicare Advantage plans, what you'll hear are terms like HMO or PPO, and they're very similar to maybe what you would have had with your employer coverage. And so there is a network that you have to stay in within that Medicare Advantage plan. So this is why you have to make sure that your doctor is in network, your clinic is in network, your hospital is in network. The other thing is that there is some out-of-pockets that costs that you will incur. And those come to you in the form of co-payments, co-insurance, and deductibles. Again, this is in contrast with original or traditional Medicare, which you usually get when you turn 65 and you get that little red, white, and blue card in the mail that says Part A and Part B. It also has your start dates, and it gives your own unique ID. And so the difference is with original or traditional Medicare, you can go to any provider in the country that accepts Medicare assignment. So no matter where you live, if you travel within the country, you can go and see a provider as long as they accept Medicare assignment. And so in 2020, there was only roughly 1% of all physicians treating adults who had opted out of the Medicare assignment. And so as you can imagine, traditional or original Medicare is a very large network. But let's get down to the issue at hand as to why Medicare Advantage plans are growing in popularity and why there's an appeal to them. So in order to understand that, what you have to understand is the funding for Medicare Advantage plans. And so when this agreement was made to allow Medicare Advantage plans into the system and beneficiaries to use those private health insurance plans, what ended up happening was that the Center for Medicaid and Medicare Services, or Medicare and Medicaid Services, made an agreement where the funding for these Medicare Advantage plans would come from the CMS or from the Medicare pool, so to speak. And so the way that it works is the more people who enroll in a Medicare Advantage plan with these private health insurance company, the more funds that are diverted into these plans. And so in exchange, the Advantage plan, rather than Medicare, ends up taking on the role of care for Medicare beneficiaries. Now, I don't have to tell you, you can do your own research, but there are a lot of critics who have raised concern about this because, as you can imagine, there can be wasteful spending with these types of plans. So basically what ends up happening is that Medicare Advantage plans make bids, and they make a bid regarding the estimated number of people on their plan they hope to enroll. And then each county has a benchmark amount to which Medicare compares these bids. And so what happens is that with the Medicare Advantage plan, each company, and I hear this from a lot of people, they go, I got so much mail from all these companies right when I turned 65. What's the deal? Well, what happens is these Medicare Advantage plans are easy to advertise. And the reason that they're easy to advertise is because many of them offer low or even no monthly premium. In fact, I think the average Medicare Advantage plan premium right now is probably around $20 a month. So it's very appealing to people because they hear that number and they think that's a low number, free's even better. The other thing is these Medicare Advantage plans are able to provide coverage that original or traditional Medicare doesn't. Things like dental coverage, vision, hearing. Some of them even have gym memberships. Some have meals and even transportation. And so they also include prescription drug coverage. And so it's very appealing to people when they hear these advertisements. They hear low premiums, they hear extra benefits, they hear all of that, and they think, wow, this sounds really, really good. What I always tell people is you have to investigate the outline of coverage or the summary of benefits, though, because inside those details is where you're going to learn your the cost sharing that you're going to have. One story that I tell all the time is I was helping someone compare two different Medicare Advantage plans, and with one service they had a simple $15 copayment. Well, with the other plan for that same service, it was a 15% coinsurance. So as you can imagine, that number can vary greatly. Here's what I will tell you. A lot of people hear $0 premium and they think free Medicare plan, but that's not the case. For instance, you always will have to pay your Part B monthly premium, right? And so this year in 2023, that monthly premium for Part B is $164.90. And the other thing you have to take into consideration is that with these low Medicare Advantage plans, there's still coinsurance, co-payments, and deductibles. In fact, each one has a maximum out-of-pocket for the year, and some of them can be in the thousands of dollars. So what I always tell people is Medicare Advantage plan is really good if you are healthy and know you're going to stay healthy. But if you have a history in your family of health needs or disease or whatever the case may be, you want to be able to look ahead when you first come into the Medicare program and say, if I choose this Medicare Advantage plan and this is the maximum deductible, maximum out of pocket for the year, am I okay financially to be able to cover that? And so actually what's happening right now is there's a lot of crackdown from CMS on marketing because they want to make sure that the marketing is not deceptive. So my encouragement to you is this: when you see these advertisements or when you hear about low, $0 Medicare Advantage plans or extra benefits, make sure that you read the summary of benefits or the outline of coverage. And make sure you see the nuts and bolts of that plan and understand what's covered and what's not covered. Understand where your out-of-pocket costs may be. And this is one reason that I chose to get into this, was because I could see the confusion, I could see the frustration with people that I knew personally connected to the Medicare program. And I wanted to be able to help people really understand the program, really understand how these plans work, so that people could be confident in the choice of coverage that they make. So I hope you found this video helpful. If you did, please hit that like button, subscribe to this channel. If you have any questions, leave them in the comments below. I'd love to hear from you. Thanks for watching. Have a great day.